Chris Roy with the Summit Institute for Orthopedic Spine and Human Movement in Hutchinson, Kansas, and I serve with the Advocacy Council as our co-chair for the AAOE. I'm here to provide a quick overview of Executive Order 14221, which is the Making America Healthy Again by empowering patients with clear, accurate, and actionable health care pricing information. This executive order builds on the foundation of Executive Order 13877, and it emphasizes stronger enforcement and clarity in price transparency for healthcare services. It does this by directing federal agencies to more actively enforce transparency rules with updated penalty structures and oversight. Hospitals and insurers must clearly disclose real, up-to-date pricing of services, not just estimates. It requires standard pricing formats so that information can be gathered by patients and they can compare cost across providers. And it supports digital tools to help calculate total costs, including deductible and coinsurance. It improves access to quality data by encouraging publication of quality metrics alongside the pricing, items such as complication rates and patient satisfaction scores. It also aims to help patients balance cost and care quality in their decisions. Another thing is it expands the list of services that are considered shoppable. Many of these services are orthopedic in nature, like injections, imaging, and different outpatient surgeries. Orthopedics is heavily impacted because it involves high volume, high cost procedures that patients may shop for, especially in outpatient or ambulatory settings. Some of the opportunities that I think exist with this order are opportunities to do bundled pricing and create fixed cost packages for surgeries, such as total knee replacement, which make those offerings more attractive. It's also a way to differentiate yourself in a market. High-performing practices and hospitals can showcase outcomes and pricing to attract cost-conscious patients and employers. And it also gives us an opportunity to work with direct contracting with self-insured employers or health plans. And that's one of the things that we've done a lot of here at our organization of Summit by building out direct pay arrangements with these self-funded employers. Some of the challenges, it's hard to get the data. It took a long time for me to make sure our machine readable file included all the needed things to be compliant this year. I think the entire process, probably working 10 hours a week, took me about 3 weeks to knock it out. So about 30 to 40 hours. A lot of that's going to be EHR dependent. How quickly you can access the right data from your EHR is going to make a huge difference in how long it takes for you to be able to have a compliant file. Practices have to ensure the pricing data is accurate, it's digital, and it's accessible. Usually there's some kind of a tech investment in making sure that that's done. One of the other risks or challenges that might exist is transparency is going to reveal who's priced high in a market and who's priced low. So practices and hospitals might have to adjust just based on their site of service for that patient that they now compete for in that free market. The other thing that I see happen is patients are confused about how medical costs are tabulated. They have questions. A lot of them don't understand posted price versus their actual out-of-pocket expense. So there's some confusion that can be created. So there's a lot of opportunity to enhance your patient education on what they're buying for. One little note, just kind of an update. So with this enforcement order, there have been fines going out. So as of April of this year, 2025, 18 hospitals have been fined for non-compliance with the hospital price transparency rule. Penalties that have been issued have ranged anywhere from $44,000 to $979,000, depending on the hospital size and how long they were non-compliant. So in summary, Executive Order 14221 is an evolution of healthcare price transparency policy for orthopedic practices. It raises the bar for clarity, consistency, and price disclosures. It creates both market pressure and competitive opportunities, and encourages value-based care models like bundled payments and transparent outcomes. It's a good moment for orthopedic providers to reassess pricing structures, optimize digital tools, and lean into data-driven care delivery. So make the decisions that best for your organization, and reach out to the Advocacy Council if you have any questions. Certainly reach out to me direct, and love to talk to you and offer you more insight and information. Thank you, and have a wonderful day.